Hello listeners and welcome to this podcast. My name is Dr. Emma Brown and I am a clinical teaching fellow on the Masters of Critical Care programme. I would like to introduce and welcome Marika Nemeckova, a student who has recently obtained her master's degree with merit and who has kindly volunteered to share her experiences of studying with us here at the University of Glasgow and the Queen Elizabeth University Hospital Critical Care Department.
My name is Marika. You know that I have been a nurse for past 20 years, but on critical care in Newcastle, I've been working in past 7 years. I have finished my critical care degree 2 years ago. I got first class honors and I was up to a challenge and consolidate my knowledge in the critical care field. So I contacted Mo, who's given me opportunity to study in Glasgow.
Okay, fantastic. We're very interested in your experience of studying the Masters in Critical Care. Why did you choose to study the Masters in Critical Care with the University of Glasgow?
I am a critical care nurse. I've been working as a critical care nurse for the past 7 years, and I wanted to consolidate my expertise in critical care and as well as in sepsis, which this course allowed me to do that.
And did you choose to study the Masters full-time or part-time?
So I had an option to study part-time or full-time, but I've chosen to do it full-time. I was up to a challenge. Yes, I knew that to study there, it will involve traveling twice a day. In the morning, 5 o'clock, I was hoping always to get home before midnight. Then Tuesday, Wednesday, I would have my time for my tasks and prepare for presentation on Thursday. And then Friday, Saturday, Sunday, I would work 12-hour shift in Newcastle critical care. So I was doing this for a past year. And now I'm leaving critical care and going to be doing full-time PhD at the University of Northumbria. So yeah, it was challenging but a really rewarding experience to study full-time, because I advanced my skills such as organizational skills and time management skills as well, which is important aspect.
So you're moving on now to study a PhD?
Yeah.
And it's a critical care related PhD?
It's sepsis related PhD, yeah.
So you found that studying the critical care was valuable for your future career prospects?
Yeah, one of the 6 modules were focusing on sepsis, so I could advance my knowledge and skills in sepsis through the variety of different learning methods that were introduced in this course. So, yeah.
So of all the topics that you were presented with during the programme, do you feel that sepsis was the one you gained the most from studying?
So I feel like I have learned quite a lot from critical care as a subject. I have learned aspects from critical care governance module as well as causes of multi-organ failure, management of multi-organ failure. So I feel like I have advanced my knowledge to different level in the field of critical care. But most importantly, I have identified gaps in literature about sepsis, and that helped me to identify the topic for my dissertation and as well as for my PhD. So, yeah.
So that's really exciting for you then. So it's been a progression from studying the Masters in Critical Care, and you're now about to embark on a PhD related to sepsis in critical care. Can I ask then, though I have an inclination, what did you enjoy most about the programme?
I really enjoyed that the program has been delivered through a variety of different learning methods, from lectures, which has been valuable asset to my expertise. I had the opportunity to be involved in multidisciplinary programs, as well as seminars and simulations. So really, this course exceeded my expectations.
So you would recommend the Masters to your colleagues?
Yes, if somebody is up to challenge and is determined and want to consolidate their knowledge in the field of critical care, definitely.
I'm interested in your dissertation. I was wondering, do you plan to present the findings of your dissertation at a conference?
Yeah, so that is my plan. So hopefully, as will start my PhD in 2 weeks, I will be able to start working on this as well.
And what advice do you have for future students who wish to pursue the Masters in Critical Care?
It can be challenging. So what I would advise is maybe to take a little step at a time and to focus on feedback, what you receive from the tutors, and try to reflect on it and keep focus on learning outcomes, because it's so easy to get distracted in so much literature out there. So yeah, main thing, focus on learning outcomes of the module and always reflect on the feedback from the tutors.
And beyond your PhD, what are your plans following that?
I would like to make an impact for patients who suffer from sepsis. So hopefully one day I'll be able to make an impact worldwide and show my determination and my knowledge and skills, what I've learned throughout the course in Glasgow during my PhD, and hopefully I'll be able to fulfill my dream.
I think you will. I was wondering, in terms of your research and scientific writing skills, do you think they have improved from studying the Masters in Critical Care?
Yes. So one of the main expectations what I've had when I started to study in Glasgow was to obtain adequate understanding of every aspect of critically appraising literature, and that was the main thing that I have learned, and that is actually essential for my PhD. So yeah, definitely.
And Marika, aims of the critical care programme is to produce effective clinical leaders. Do you find that this has been achieved?
This course is designed to advance their knowledge to the point where they become a leader in a field of critical care. Yeah.
That's lovely.
And Marika, do you have comments you would like to provide on your experiences of the Masters Critical Care programme?
I just would like to say that I am glad that I have studied in Glasgow. I wasn't sure at the beginning because I was working full-time and studying full-time as well. I had to travel twice a week to Glasgow. But when I look back, I'm really glad I've done it. So I feel like I've grown in my personal development so much. So yeah, I would like to thank you actually everybody for giving me this opportunity to study there. Thank you.
It's wonderful to hear you've had such a positive experience.
Thank you.
Thank you so much for taking the time, and best of luck in your future endeavours.
Thank you.
Thank you so much.
Thank you so much to our listeners and to Marika. We hope you have enjoyed this podcast today. Should you wish any further information on our programmes, both online and on campus, then please do not hesitate to contact us at MVLS, that's M for Mike, V for Victor, L for Lima, and S for Sierra, _critcare@glasgow.ac.uk. We look forward to hearing from you, and please have a wonderful rest of your day.